Domestic violence doesn't discriminate. It doesn't just affect the poorer communities or the less educated communities. Domestic violence is a widespread issue that touches all of us. Victims of sexual assault and domestic violence often don't speak up about what they're going through. They feel afraid, they feel helpless, they feel embarrassed. So they don't talk to their families, their co-workers, their neighbors, or their friends, and they just keep it to themselves and the violence continues. What Newton-Wellesley Hospital is doing is providing a caring environment, a safe environment, and a hopeful setting for victims to speak up.
The most recent numbers I saw were that over 200 patients a year were coming in for domestic violence. Nobody can handle all of that alone, and therefore we need another person. We hope to raise enough funds to increase the personnel. This is a very personal issue. You have to have someone who's highly trained, very invested in the issue and knowledgeable about the issue, and you have to have somebody who's skillful in making the patient feel comfortable.
In communities such as this, I find that people will come to the hospital and disclose to their doctor, to a nurse whom they trust, to a physical therapist, when they would never call a hotline, when they would never show up at the doors of many of our really amazing community partners. They will disclose to a doctor and they'll come to my office, and that feels so much more comfortable to them. It feels less stigmatizing.
The hospital has had a long-term investment in both domestic violence and sexual assault issues. Since 1993, we've been working on trying to decrease domestic violence and being a resource in our community. And in 2008, we were able to establish a formal program with a full-time individual who is focused on domestic violence, both in the emergency room and on education throughout the hospital. In terms of sexual assault, we were one of the first community hospitals that had the capacity for forensic evaluations.
With this sexual assault nurse examiner program, we have developed a very succinct kit that is clearly marked out, and the steps to it to go through to collect the evidence. And with this, and with the training that is done, the prosecution rate has really increased. We're seeing an increasing number of college-age students coming in seeking treatment after sexual assault. Anywhere between the ages of 17 and 21 have been coming in, and I believe it's due to our outreach out to the college campuses and our education, because oftentimes it's not the victim because they're so traumatized, but it is their roommate or somebody that may have attended one of our seminars that we're holding on campus.
It's happening to someone you know, so let's increase awareness and our resources so we can help the people out there who need it.
The Governor and I want to applaud Newton-Wellesley Hospital's efforts in addressing the issues of domestic violence and sexual assault in its community. The work that the hospital is doing to ensure the security and well-being for some of its most vulnerable citizens is vital to making the community a safer and better place for all of its citizens. Please support this critically important cause.